my name is Alyssa, and I'm going to be your nurse today. Could you just tell me your name and date of birth, please?
Miley Deward, 5593.
Okay, I'm just going to go ahead and verify that with your wristband. Okay, so that matches up good. Is it okay if I call you Marley?
Yep.
Okay, so I'm just going to explain what we're going to be doing today. We're going to be doing a simple head-to-toe assessment. It's going to involve some touching, some listening, and just asking some questions. Is it okay if we begin?
Yep.
Okay, so I'm just going to start with a general survey. When I saw you walk in today, you were dressed appropriately for the weather. I also saw that you had a nice steady gait. How are you feeling today, Marley?
Good.
Good, so you seem to be in a good mood. As I can tell, you're answering my questions appropriately. It also looks like you showered today. Your hair is nice and clean, face looks clean, you look very put together. So now I'm just going to ask you a couple questions. It may sound a little silly, but could you just tell me your name again?
Miley Deward.
And where are we?
Hudson University.
Why are we here?
For a head-to-toe assessment.
And the approximate time.
1 o'clock.
Okay, so your oriented times 4 to person, place, time, and situation. So now I'm just going to begin by doing some vital signs. So I'm first going to start by doing blood pressure. Does it matter to you which arm we use?
No.
And go ahead and use this arm. Go ahead and put the pillow. Does that feel okay?
Yep.
Okay. Okay, so I'm just going to begin now for feeling your brachial pulse. So you're going to go down to your radial pulse, and I'm going to go ahead and I'm going to feel it, and then I'm going to pump it up until I can't feel it anymore, and that's going to be your estimated systolic. Okay, so I felt that your pulse went away at about 100, so when I go ahead and do it again, I'm going to pump it up to 130. But I'm going to give your arm a little break, and I'm going to go ahead and feel your apical pulse now.
Okay.
And I'm just going to be going down to your third intercostal space, left sternal border.
Okay.
Is it okay if I pull this down a little bit?
Yep.
Okay, so I found that your pulse was 74, and I also did your respirations, and those were 14, which are also both normal findings. So now we're going to go ahead and move back to your blood pressure. So I'm going to begin now by just finding your brachial pulse. Okay. So now once again I'm pumping it up to 130. So I found that your blood pressure was 124/74, which is also a normal finding. So we can go ahead and take this off now. Go ahead and move this. Are you having any pain today, Marley? No. Okay, if you had any pain, I go through a scale of 0 to 10 and even go through cold spot. So now I'm just going to do a little general survey of your skin. It looks like your skin tone is correct for your ethnicity. Looks like the skin is even throughout. I'm not seeing any major cuts or lesions. When I go through each system, I'll be looking at the skin more carefully. So now I'm just going to begin with your head. So I'm now just going to inspect it. So it looks like you do have even hair distribution throughout. I'm not seeing any bald spots. Your hair looks very healthy. It doesn't look too oily, no dryness or flakes, which is all normal. So now I'm going to go ahead and palpate. I'm feeling for any lumps or bumps, and just let me know if you have any tenderness. Do you feel any tenderness? Okay, I didn't feel any lumps or bumps, which is normal. So now I'm going to go ahead and move on to your face, and I'm just looking for symmetry. So I see that your eyebrows and eyes are symmetrical on both sides. Your nose is midline, and so is your mouth, which is normal, and your cheek folds are also symmetrical on both sides. So overall, your face is symmetrical. So now I'm going to be testing cranial nerve 7. So that is going to be your facial expressions. So if I can go ahead and have you smile, frown, show your teeth, puff your cheeks, and raise your eyebrows. So cranial nerve 7 is intact. I'm now going to go ahead and palpate your temporal arteries, and I'm feeling for any elasticity. Okay, so I feel like they have a +2 pulsation on both sides, and they're symmetrical. Did you feel any tenderness?
No.
Okay, so that is normal. I'm now going to be testing cranial nerve 5, which is your sensation to sharp or dull. So I'm going to go ahead, and I'm just going to be using this, and I'm just going to have you close your eyes and tell me if it's sharp or dull, and where it is on your face. And this is dull, and this is sharp. Okay?
Yep. Dull chin. Sharp left cheek. Dull forehead. Sharp right cheek.
Okay, so cranial nerve 5 is intact. So now we can go ahead and we're going to move on to your eyes. So I'm first just going to inspect. So I see once again that your eyes are symmetrical. The outer canthus of your eyes lines up with the tips of your ears, which is normal. 1/3 of your eyelid covers your eye. It looks like you have even eye distribution, which is normal. So now I'm going to go ahead and I'm going to be testing cranial nerves 3, 4, and 6, which is your cardinal fields of gaze. So I'm just going to have you follow the pen light. Okay, so cranial nerves 3, 4, and 6 are intact. To also test cranial nerve 3, I'm going to go ahead and shut the light off. This is going to be your pupillary restriction as the accommodation to light. So I'm just going to go ahead and have you look straight at me. I'm looking at both of the pupils constricting. Okay, so both of your pupils constricted rapidly. So cranial nerve 3 is intact. So now I'm going to go ahead and I'm moving on to your mouth. And first I'm just going to inspect your lips. So I see your lips are nice and pink and moist. No cracks or dryness. I just go ahead and have you open your mouth. Okay, and I can visibly see that your tongue is midline. It looks nice and pink. Looks like your teeth are nice and white and straight. Your uvula mucosa looks nice and moist and pink. Your soft and hard palate look nice, moist, and pink. Your uvula is midline, and I can't see your tonsils, which is normal. So now we're going to be testing cranial nerves 9 and 10. To test cranial nerve 9, I'm just going to have you open your mouth and say ah. Okay, so cranial nerve 9 is intact. I saw your uvula moved up with phonation. To test cranial nerve 10, we would be using the tongue depressor. I'd be checking your gag reflex, but we're not going to be doing that today. So now I'm just going to test cranial nerve 12, which is range of motion of your tongue. So if I could just go ahead and have you stick your tongue out, move it up, down, side to side. Okay, so cranial nerve 12 is intact. So that completes the head, and I'm just going to move on to your neck now. Now I'm going to begin by just inspecting. Once again, I see an even skin tone throughout, no cuts or lesions. See a couple freckles, but that looks normal. It looks like your trachea is midline, but I'm going to go ahead and palpate it now. Please let me know if you have any tenderness. I'm going to the sternal notch. Okay, and I found that it was midline. Did you feel any tenderness?
Nope.
Okay, so now I'm going to move on and auscultate, palpate your carotid arteries first. So I'm going to go ahead and go over from the trachea. Okay, so I feel like that has a strong +3 pulsation. I'll go on the other side. Okay, so I also feel that that has a strong +3 pulsation. They're symmetrical on both sides. I'm going to go ahead and auscultate now with my bell, and I'm listening for any bruits. So I didn't hear anything, which was a normal finding. So now I'm going to go ahead and I'm going to palpate your lymph nodes and just let me know if you have any tenderness, okay?
Yep.
So I'm going to go preauricular, posterior, occipital, tonsillar, submandibular, submental, anterior cervical chain, posterior cervical chain, and supraclavicular. Did you feel any tenderness?
Nope.
And I wasn't able to palpate them, which is a normal finding. So now I'm just going to test the range of motion of your neck, which is cranial nerve 11. So if I could just have you put your head down, back, and side to side. Okay, to also test cranial nerve 11, we're going to do shrug your shoulders. So if I just have you lift your shoulders up, then against resistance. Okay, so cranial nerve 11 is intact. I'm also going to be testing your head against gravity too. So if I go ahead and have you push against my hands, push against my hands, push against my hand. Okay, so your head was able to move against resistance and gravity, which is normal. So now I'm going to go ahead and I'm moving on to your posterior back. So if I could just go ahead and have you turn around. Is it okay if I open this a little more?
Yep.
Okay. So I'm just going to begin by just inspecting, and overall I see that your skin tone is even. I see no cuts, lesions, see a couple freckles, but nothing out of the ordinary. I can clearly see that your spinal column is midline. I can see your scapula is also symmetrical, and so is your shoulder height on both sides. So now I'm going to go ahead and I'm just going to be palpating. I'm feeling for any lumps, bumps, or crepitus. Please let me know if you're feeling tenderness. Do you feel any tenderness? No? Okay. I'm now going to go down to T9 and T10 and test your chest expansion. And could I just have you take a deep breath for me? And one more. Okay, so you did have normal chest expansion. So now I'm going to go ahead and I'm going to percuss all the lung fields and I'm listening for resonance. T9 and T10 again. Okay, so I heard resonance throughout, which is normal. I'm now going to go ahead and auscultate, and I'm listening for any wheezes or crackles. So when I go ahead and put my stethoscope down, could you just take a deep breath for me? So all lung sounds were clear to auscultate. I didn't hear any wheezes or crackles. I'm now just going to test your right lobe. So if I could go ahead and have you lift up your right arm. And just take a couple deep breaths for me again. Okay. So once again, all your breath sounds were clear to auscultate, and I didn't hear any wheezes or crackles. So that completes the posterior back, and we're just going to move on to your anterior chest. So if I could just have you move forward. And before you lay down, I'm just going to check your anterior to posterior diameter. So I see you have a 2 to 1 anterior to posterior diameter, which is normal. So you can go ahead and lay down now. So I'm just going to begin by checking for JVB. So if I can go ahead and have you look to the left. Thank you. Okay, so I do see a pulsation, which is normal. And is it okay if we pull this down a little bit? Okay. So I'm just going to check your skin turgor first. So I'm just going to a little bit. Okay, so the skin rebounded quickly in less than 2 seconds, which is normal. I'm now just going to inspect your chest overall. I see you have an even skin tone throughout, no cuts or lesions, a couple freckles. I see that you're having a normal breathing pattern, no heaving. You're not using any accessory muscles to breathe, no supraclavicular tugging or nasal flaring. So now I'm just going to finish up the respiratory portion. So I'm going to go ahead and be listening to the lung sounds again. I'm listening up at the apices, the second intercostal spaces, and the 6 intercostal spaces laterally. And I'm listening for any wheezes or crackles. So could I just have you take another couple deep breaths? So once again, all your lung sounds were clear to auscultate. So now we're going to go ahead and move on to the cardiac landmarks. So I'm first going to begin by just palpating, and I'm feeling for any thrills or pulsations. So we're first going to start with the aortic, which is at the second intercostal space, right sternal border. Then we're going to go over to pulmonic, which is second intercostal space, left sternal border. And down to third intercostal space, left sternal border, Burroughs Point. Fourth intercostal space, left sternal border, is tricuspid. And then fifth intercostal space, midclavicular line down here, is going to be mitral. So I didn't feel any I felt pulsations and thrills, so that is normal. I didn't feel any thrills. So I'm going to go ahead now, and I'm going to auscultate, and I'm listening for S1 and S2. So at aortic, harmonic, I'm hearing S2 the loudest. Herb's point, I'm hearing S1 and S2 equally. Then at tricuspid neutral, I'm hearing S1 the loudest. I'm going to go ahead now and I'm just going to listen with the diaphragm. So I could clearly hear S1 and S2 at their specific landmarks. I'm now going to go ahead and listen with my bell, and I'm listening for S3, S4, any murmurs or gallops. So I didn't hear any sounds that were out of the ordinary. So that completes the chest portion, and we're going to go ahead and move on to your abdomen. Okay, so once again, I'm just going to inspect. So I see that you have even skin tone throughout. I'm seeing no cuts or lesions, a couple freckles. I can see that your umbilicus is midline. I'm not seeing any distension or striae, which is normal. So now I'm going to go ahead and I'm just auscultating, and I'm going to listen at your aortic, renal, and iliac arteries, and I'm listening for any venous hums. We'll go ahead and listen with the bell. Okay, so I didn't hear any venous hums, which was normal. I'm going to go ahead now and listen for any bowel sounds. I'm going to listen in all 4 quadrants 2 times, and once I hear something, I'm just going to go ahead and move on. So I could clearly hear bowel sounds in all 4 quadrants, which is normal. I'm going to go ahead now and I'm going to percuss all over your abdomen, and I'm listening for any tympany. Okay, so I heard tympany throughout, which is normal. I'm now going to go ahead and palpate. Are you feeling any tenderness in your stomach? No. Okay. I'm feeling for any enlarged masses or organs, and just let me know if anything is tender while I do this. Do you feel any tenderness? No, okay, I didn't feel anything that was enlarged, which is normal. So to complete the abdomen, I'm just going to go ahead and list off the organs that are in all 4 quadrants. We're going to start in the left lower, which has the ascending and the cecum and the appendix. The left upper quadrant has the rest of the ascending. It has the transverse, the gallbladder, the liver, the duodenum, and the head of the pancreas. We then go over to the right upper, which has the rest of the transverse, the descending, the stomach, the spleen, and the pancreas. We then go down to the left lower, which has the rest of the descending, the sigmoid, and then midline is your rectum. So that completes the abdomen, and we're going to go ahead and move on to your arms. So I'm just going to have you sit up.
Okay.
Is it okay if we roll these up? Yep. Okay. So now I'm just going to begin with an overall inspection of your skin once again. I see that your skin tone is even throughout. No cuts or lesions. I do see a couple freckles, but that all looks normal. I'm going to go ahead now and feel for your temperature. Okay, so I feel that your temperature is normal all the way down to your fingers. I'm now going to be palpating for your muscle tone and let me know if you feel anything that's tender. Did you feel any tenderness? No. No. Okay, and your muscle tone was symmetrical all throughout. So now I'm going to go ahead and I'm just going to palpate your radial pulses. Okay, so I feel that those have a +2 pulsation on both sides. I'm now going to be testing your capillary refill. So I see you have nail polish on, so I'm going to go ahead and do it at the skin. Okay, so less than 2 seconds, which is normal. I'm now going to test range of motion of your arms. So if I can just go ahead and have you stick out your arms, put them behind you, then up and back down. So you have full range of motion of your arms, and now we're just going to test it against resistance. So if I go ahead and have you push against my hand, push against them, push, and push again. Okay. So your arms were able to move against gravity and resistance, which is normal. I'm now going to be testing the proprioception of your fingers. So I'm going to be moving your finger either up or down. Just tell me which finger it is and whether it's up or down. So if I go ahead and have you close your eyes.
Pinky up. Thumb down.
Okay, so your proprioception is intact. I'm now going to be testing your cerebellum and graphesthesia. So I'm going to go ahead now and just place an object in your hand. And if I could just have you close your eyes, please. Go ahead and tell me what this object is.
Paperclip.
Okay. And now to test graphesthesia, I'm just going to draw a number in your hand and just tell me what it is.
1.
Okay, good. So stereognosis and graphesthesia is intact. I'm now going to do the squeeze my fingers test. So if I can go ahead and have you squeeze my fingers. Okay, so you have symmetrical muscle strength on both sides. To complete the arms, we're just going to do the rapid hand movement. So just follow along with me. And then go ahead and move faster. Okay, so you were able to move your hands with rapid hand movements. I'm now going to go ahead and move on to your legs. So I'll go ahead and have you lay down again. Just move this up a little bit. Okay, so I'm going to begin by just inspecting. Is it okay if I take your shoes off?
Thanks.
Okay, so I see that you have even skin tone throughout, no cuts or lesions that I can see, a couple freckles. I'm going to go ahead now and feel for your temperature. Okay, so I see that you have even temperature all the way down to your toes. I'm going to go ahead and palpate now. I'm feeling for the muscle tone. Let me know if you feel any tenderness.
Okay.
Do you feel any tenderness?
No.
Okay, and your muscle tone was symmetrical on each side. So I'm going to go ahead now and I'm going to palpate your pulses. So we're going to feel for your dorsal pedis, posterior. Okay, so they all had a +2 pulsation, were symmetrical on both sides. I'm going to go ahead now and check your capillary refill. You do have nail polish on, so once again I'm going to do it on the skin. Okay, less than 2 on that side. Less than 2 on this side too, so they're symmetrical on both sides. I'm going to go ahead now and test the proprioception of your toes. So just close your eyes again and tell me if it's up or down.
Down. Big toe up.
Okay, good. So your proprioception is intact. I'm now going to test the range of motion of your legs. So if I can go ahead and have you lift up your leg and move it in, out, and back down. Then the opposite leg up, in, out, and back down. So you had full range of motion of your legs. So now I'm just going to test them against resistance. So can I have you push against my hands? Good. This one. Okay. So you're able to go against gravity and resistance, which is normal. I'm now going to test the sensation of sharp and dull. So I'm just going to tell you that this is sharp, and then this is dull. Now just have you close your eyes again.
Dull. Sharp. Dull. Dull. Sharp. 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 Dull. Dull. Sharp. Dull. Sharp.
Okay, good. So your sensation for sharp and dull is intact. I'm now going to be checking your vibratory sense. And I'm going to go ahead and tell me when you feel the vibration and when it stops.
Okay.
And I'll just have you close your eyes again.
Vibrating. Stop. Vibrating. Stop. Vibrating. Stop. Vibrating. Stop.
Okay, so your vibratory sense is intact. Okay, so now I'm just going to have you stand up for me, please. And just have you turn around. I'm going to have you bend down, and I'm checking for scoliosis. So I can clearly see that your spinal column is midline. Your scapula and your shoulders are symmetrical on both sides. Now go ahead and have you stand up and put your hands on your hips. Okay, so I can clearly see that your arms make an even and symmetrical triangle, which also shows you do not have scoliosis. So now we're going to go ahead and just check your gait. So if I could just go ahead and have you walk over here. Okay, so I saw that you have a nice even gait with a nice stride. Your hands are moving in opposite directions, which is normal. So could I go ahead and have you walk heel to toe, please? Okay, so you were able to complete the tandem walk, which is checking cerebellum function. We're now going to test the Romberg's test. So I'm going to go ahead and have you stand with your feet together, then with your eyes closed for 20 seconds. Okay, so you were able to complete Romberg's test, which was checking cerebellum function. The final test will be the finger to nose test. So you go ahead and just do this, and a little bit faster, and with your eyes closed, please. Okay, so you're able to complete that test, which was checking cerebellum function. So that completes our head-to-toe assessment. We found all normal findings. Do you have any questions?
Nope.
Thank you for your time.